David, quick welcome and thank you so much for joining. For those who may not know you yet, how do you usually introduce yourself and what you do?
I am a dental sleep specialist, which is basically a dentist that specializes in dental sleep medicine,
Mhm.
the treatment of obstructive sleep apnea, snoring, and upper airway resistance syndrome, which are pretty much all keyed together. So I work in integration with a lot of physicians and neurologists, sleep physicians, and pulmonologists that treat patients who have been diagnosed with sleep apnea and may not want to use a CPAP machine for
Uh-huh.
their treatment.
Got it. And what first led you to pursue sleep medicine and alongside with your dental career?
It was actually myself. I was a snorer 25 years ago, and it was one of those annoying things that
Yeah.
my spouse was very uncomfortable with. And I went down a path of trying to treat that. I
Mhm.
was diagnosed actually just with snoring, and then I had the opportunity to make some appliances on myself, some devices that fit in my mouth that bring my jaw forward, open up my airway, and
Mhm.
allow me to no longer snore. And that's really how I made the inroads into it. It's now become a passion for me. I'm the immediate, well, one, I'm not the immediate past president. I'm the second past president of
Uh-huh.
the Academy of Dental Sleep Medicine.
Ooh.
I teach people this. I train through the Academy's mastery program. So I've been very involved in it from that higher level. The Academy now has over 3,000 members internationally.
Beautiful. And I bet your wife is pretty happy now, sleeping good.
Pretty pretty happy, yeah. That's the big impetus for a lot of our patients is that they feel much better when we see them and we treat them.
Uh-huh. Beautiful. And it's mostly the vices that you guys use, or is there anything else that comes with the treatment?
So our therapy is predominantly in the mouth.
Mm-hmm.
So most patients are familiar with orthodontic retainers,
Mm-hmm.
night guards that might be used for grinding and clenching. And this is something very similar. It fits in the mouth, but it slightly gently positions the mandible forward so the patients can sleep more comfortably versus
Mm-hmm.
having air blown on their nose or their face with a CPAP mask, which is one of the major treatments for obstructive sleep apnea now.
Got it. And what is your thought about surgeries related to this? Like, do they really work?
It's a great question. And depending on what the goals are, there are many patients that oral appliances will not work for because of their severity of
Mm-hmm.
disease. And then there's also patients who have so much obesity or morbidly obese or overweight that the appliances won't correct the problem. And they
Okay.
need to be either on CPAP or in conjunction with CPAP. Some of them require surgery, which could be there's a fair number of different types of surgeries. Those can be throat based surgeries where they're reducing the size of the tonsils and the uvula along with the soft palate. And then there could be actual surgeries that are advancing the jaw, which are much more aggressive surgeries where they open the airway by bringing the jaw forward, upper and lower jaws forward surgically.
Wow.
Pretty significant surgery.
Mm-hmm.
And the third type of surgery would be one where they're using Inspire or a hypoglossal nerve stimulation to coordinate the stimulation of the tongue along with the patient's breathing. And that's a very relatively new in the last 5 years. We're seeing a lot more use of that particular
Mm-hmm.
type of surgery. It
Okay.
doesn't always correct it. Patients don't always like it. So, of all the treatments, ours is the most benign
Right.
therapy that can be utilized.
Got it. And it's the one you should always start with, and then
In my
proceed.
opinion, yes.
Uh huh.
If you talk to some of my sleep physician colleagues, they may say differently.
Okay.
But for patients who have mild disease, mild apnea, as defined by the American Academy of Sleep Medicine, oral appliance therapy should be used as an initial, I shouldn't say should, it could be used as
Mm-hmm.
initial
Mm-hmm.
therapy.
Got it. Understood. And in your journey so far, what has been one of the biggest lessons that you learned helping patients?
Another great question. I think that the thing that I think of most is that patients are typically given an all or nothing
Mm-hmm.
option for treatment.
Mm-hmm.
Mr. Smith, you need to have CPAP,
Mm-hmm.
but they've never been given the option of an oral appliance. And for many of those patients who are even in the severe category, they actually have very beneficial use of an oral appliance. So I think the most impactful thing that I've seen over my career is the jumping forward to the conclusion that CPAP is the only therapy. And what
Mm-hmm.
I've been most surprised by is that even patients with significant disease can be improved to a point that they've gone from a severe state to a mild state,
Mm-hmm.
as well as improving their quality of life. So, a significant reduction in snoring,
Mm-hmm.
which is the main reason a lot of patients have sought treatment to begin with.
Yeah.
So,
Uh-huh.
it's kind of weird that that happens that way.
Got it. And what are some common misconceptions that patients have related to dental sleep medicine?
And this is promoted, or I should say, it's put out there. A lot of it seems to be promoted by the sleep physicians who are ordering CPAP machines.
Okay.
And you have to understand there is a little bit of a competition here because the some of the physicians are integrated with durable medical equipment and supplying CPAP to some of their patients. But I think that the biggest issue to me seems that the appliances are not going to work and that they may cause bite changes and jaw pain. And
Mm.
just like any treatment that we have, whether you're taking a pill, all you have to do is listen to a pill about an ad on the
Oh
evening
yeah, at
news
the end.
about any pill, and the side effects that they have to list in that last 20 seconds of the ad are disgusting enough that
It's
no one would
terrible.
want that
Totally.
function. We have to talk about that in logical terms. And if a patient chooses to use an appliance, they know, at least in my practice, they know that there's a risk that their bite can change. There's a risk that
Mm.
their teeth may shift a little bit. And there's a risk that they might develop some muscle soreness in the jaw joint. But all those are manageable. They're, again,
Mm-hmm.
those are manageable things.
100%. I think there's always a risk, not just related to anything in medicine, but there's probably always a risk in anything in life that you're gonna try. So at the end of the day, you should just review more of like the pros and the cons, and probably this would give you more pros than cons. So uh, definitely it would be worth it to try.
I think you have to also remember that most of these patients have already tried CPAP machines
Mm.
as a first choice,
Mm-hmm.
and now they're kind of their backs up against a wall. Do they want to do surgery or do they want to
Uh-huh.
do something more reversible? And this
Right.
happens to us every day. We see patients who come in and say, "Well, I was told that my CPAP wasn't working.
Mm-hmm.
I was referred for Inspire surgery, and I went through the process of being evaluated for that. And now they're like, do I do that?" And I said, "Well, did anyone ever talk to you about an oral appliance?" And they said, "No. What is it?" And I'm like, "Oh my God,
Oh
that's great.
God.
No one's ever said." So
So with related to the dental appliances and the CPA machines, is there a big difference in the price of these things?
well, you have to look at this in a couple of ways. The
Mm-hmm.
CPAP machines have an initial upfront cost.
Mm-hmm.
Yes, it's usually covered by insurance.
Okay.
And then there's the supplies that have to be on a 3-month basis, have to be changed out, the hoses, the masks. The
Okay.
oral appliance is a one time fee, which usually the appliance lasts 5 to 7 years,
Mm-hmm.
depending on the type and the durability of the material utilized. So when we compare the cost over the life of a patient's utilization is actually higher costs involved in a CPAP than it is for an oral appliance.
Mm-hmm. Mm-hmm. Understood. And
Yeah.
I wonder if some, I'm not sure, like, but it brings to my attention that maybe some dentists select the CPAP's option first because it brings a little bit more money right away. Could be.
Well, very few dentists that are actually prescribing the CPAPs for their patients.
Oh, okay, it's doctors.
Yeah,
Got it.
there's
Okay.
a lot of physicians that are.
Got it.
A
Understood.
lot of things.
Understood. Okay. And okay, for the sleep medicine, dental sleep medicine, do you see things evolving in the next 5 years? Is there anything that you're excited about?
We're seeing much more. We're seeing much more communication, and we're also seeing the integration of dentists in different facilities, like hospital-based sleep programs
Mm-hmm.
uh, taking place, sleep centers. There's a lot more dental integration there. I think that from that perspective, that's one perspective, is just a model that seems to work better. The
Mm-hmm.
other thing is just the integration of design, material sciences, and computer AI, computer generated things,
Right.
and also the diagnosis. We can now monitor patients remotely with
Oh,
certain
nice.
certain types of home-based products. You're familiar with, like, the Aura Ring
Uh-huh.
and like that, the watches from Apple and Samsung and all the
Uh-huh.
other, and Google and all those. They have components that allow us now to monitor those patients' efficacy of their treatment. So it's really
Oh,
quite impactful for those patients
that is amazing. I didn't even know about that. Beautiful how technology is helping us more and more every time.
every day.
Yeah. And okay, for dentists that might be interested in incorporating dental medicine, what do you think is the best place to start?
So I'm going to be biased here because the academy that I was
Right.
president of for 2 years and was on the board for 10 years is really the preeminent educational group, an unbiased, not-for-profit organization, and that's the American Academy of Dental Sleep Medicine, the
Mm-hmm.
AADSM. They can go to aadsm.org to learn more about it. But we have a learning program. We have courses that are put on around the country, and teams of mentors around the country. Again, we're about 3,300 members around the world. I have colleagues in Spain and
Oh
uh,
wow,
in
nice.
throughout Europe and Australia that are all part of our academy. So we have a really great network of people. People
Mm-hmm.
ask me all the time, "Do you know somebody in Spain?"
Mm-hmm.
And I'm like, "Yeah, what part?" And they're like, "You know somebody in different cities?" And I'm like, "I know people all over the world these days."
That's amazing.
Yeah. So I think that that's a really great place to start. Some of their local labs might even be giving them the opportunity to learn in places like that. So, for
Mm-hmm.
instance, I'm giving a course, a lecture in September in Iowa City, so a smaller community,
Mm-hmm.
but at a local lab that has people that send them, dentists that send them work. And so they can check with their local labs as well. But I think that the main one would be the American Academy of Dental Sleep Medicine.
Got it. Perfect. And when dentists are trying to start this, is there any maybe common mistakes that you've seen that they do?
All the time. And the problem is they can really hurt somebody
Okay.
because they can make the assumption that a patient just snores, but they actually have apnea, and so
Mm-hmm.
they want to treat these patients without having any knowledge that maybe they're trying to treat obstructive sleep apnea when the patient when trying to treat snoring when the patient actually has obstructive sleep apnea, which is much more severe.
Uh-huh.
That would be the first one mistake. The second one would be where they they don't know that there's multiple types of appliances to fit into a patient. Somebody who has beautiful teeth as you do versus somebody else who has a smaller mouth may require a different type of an appliance, and therefore we would customize the device to those patients. And they will make the mistake of looking in a magazine and seeing one device
Mm-hmm.
from one particular, laboratory, and find that that is, and they make that appliance, but that may not have been appropriate for the patient. So
Got it.
it all starts with the basis of education. They have to learn. You don't know what you don't know.
Exactly. Yeah. And how can they hurt people? Like, can they move their teeth, or what else can they do? Um.
Well, they can ineffectively treat them or think that they're treating them
Uh huh.
when in fact they're treating the snoring, but the snoring hasn't completely gone away.
Got it.
And yet this is a health concern. This is a concern where patients can die from untreated obstructive sleep apnea.
Wow.
We had Supreme Court Justice Anthony Scalia was not using his CPAP the night that he passed away.
Oh,
They found his CPAP next to his bed, not on his face. So this is a thing that patients can die from.
got it. So it's like putting a band-aid to the
Well,
brain.
it's putting a band-aid on a gushing wound. Yeah, it's not going to help.
Correct. Got it.
So.
Understood. And is there any specific like newer technologies or advancements that you're seeing in the space apart from like, what you told me about the watches and tracking like
Yeah,
that?
not really. The utilization of cone beam technology, which is a three-dimensional X-ray of the airway, allows us to identify maybe particular sites in the airway that are restricted for certain patients. But there's really not nothing on our end that we haven't talked about already.
Are you able to right away when seeing a patient know exactly what he has, or is there certain tests and exams that you have to do first?
Yeah, patients have to be tested because I've been surprised. I have a lot of very petite females that will come into the office, these size 2 individuals, and yet they have very bad snoring and apnea. Yeah. And then I have patients who are large men that are obese and they don't have apnea. So it all starts with having to be diagnosed and tested. So I can look in someone's throat and see and look in their mouth and see certain things that might indicate that they're more prone to it.
Got it. And in the next 5 years, where do you see the dental sleep medicine going?
I think we're going to see a greater increase in the utilization of these devices because we're continuing to propagate more and more CPAP use and then more CPAP failures. And patients are going to go down that rabbit hole where they don't want to use the CPAP anymore. The Academy has done a really good job of getting the word out that there's other opportunities to treat this disease. There's some FDA trials going on for a pill that will help enhance the muscle tone of the throat for some of these patients. But that's still a couple years down the road. It's not going to cure every patient, and it certainly won't necessarily treat snoring in conjunction with it. It might help with the apnea per se.
And what would you tell? Because I know a lot of male, they don't care that they snore, and they don't want to go get checked. What would you tell those men?
Well, that first of all, if there's a woman that is in control of most situations, and the Colombiana mujeres are muy fuerte. And it's important that they say, listen, you're not coming into the bedroom with the snoring, but I'm more concerned about you having a lifelong, issue with disease. And it can cause a heart attack. It can cause cerebrovascular issues, strokes, and hypertension. So I think if you approach it from that aspect, whoever the partners are, they can turn to their loved ones and say, I'm concerned because of these things going on that you need to be checked.
Correct. Yeah, I think it's a little bit of more awareness that people need to have, because I am pretty sure a lot of people, they just think they just snore and they don't think it's anything else more than that.
Right.
Okay, now let's talk a little bit about digital marketing. So in your practice, have you guys tried any digital marketing, and has anything worked for you or anything that hasn't worked for you?
I'm in a very unique situation because I've been doing this for a long time, and I have established relationships with physicians in the area. And so our marketing is not so much oriented towards that. On our website, we do have links to certain places that my patients can go to if they're looking for that. But for me, it's a little bit different. But these neophyte dentists who are involved in the dental sleep space, who don't know how to get the patients in the door, they really do need to consider to utilize those things, letting people know that they are qualified dentists doing this, that they've gone through training, and that they have the necessary skills to provide high-level care.
Correct. Yeah, I actually have a dentist client and they just added that service. So we just started we created a new campaign for that service.
Mm-hmm.
Okay. Let me see. And so the way you grow is just more like related to word of mouth and the network that you do to your like the years that you have in the industry.
I would say there's two main reasons.
Uh-huh.
One is the success stories you have with your patients,
Mm-hmm.
and then the other is the success stories you have with the physicians
Okay.
sending you patients. So the more you can refer those patients back to show that the therapy is working for those patients, the
Uh-huh.
better those physicians will feel about sending you future patients.
Got it. Got it. And have you had any challenge at all in regards of growing the practice?
Absolutely, absolutely. Because the first 5 years of the practice, nobody was, and even now, not a lot of people are understanding what is involved in this.
Okay.
So it was really getting my name out there. It was getting to meet the physicians and having them trust that I knew what the hell I was doing. In order.
Exactly. And how did you get the word out, or just through the patients that you treated?
I would go to the doctor's offices. I went
Oh,
to a
okay.
lot of the sleep physicians' offices. I met with them, showed them what these things look like.
Uh huh.
Said, if you have a patient that, if you have a patient that can't tolerate CPAP, let's try to utilize an appliance. We'll send them back. We'll do testing,
Mhm.
and all of a sudden they realize that I'm trying to help the patient. And dentists, by and large, want to solve a problem.
Mhm. Mhm.
Physicians tend to, not that they don't want to solve a problem, but they're so inundated with other therapy that they don't have the time to
Right.
do all that.
Right. Got
So
it. Got it. So it's like offering your service as a specialist in one single thing that a lot of other practices don't have, and they 100% need that.
exactly, exactly. So yeah, right now 80% of my practice is sleep medicine. I
Uh
still do
huh.
general dentistry,
Uh huh.
but the majority of it is sleep.
Amazing. Yeah, I do agree that the best thing is just to focus in one single thing and be the best at that thing. That's actually how you grow a lot the business, and that's why actually I started to focusing the agency a little bit more into the health and wellness. Because if I just can focus a little bit more on that and get more experience on that, then it's easier to get to grow the practice. Okay, David. Well, thank you so much for sharing your insights. I learned a lot. It was awesome to have you here. Is there any place where people can find you or your practice that you want to share?
I'm happy to share my email address. That's Dr. David, DRDAVID, at dentalprofessionals.com.
Mm-hmm.
And that is my main email address. I'm happy to talk to anybody, to speak with them about their journey and give them any insight I might have.
Perfect. Sounds good. Thank you so much.